The sponsor of Liftoff with Keith is the one and only CompassStrategicAdvisors.com, an experienced partner to help you navigate everything from cap tables to stock option and compensation plans and all types of backroom and marketing services. There is no better friend to the startup CEO than Compass. Check them out at CompassStrategicAdvisors.com. Today's guest is Brandy Thompson, founder and CEO of BenefitBay, a company helping employers rethink healthcare benefits through the growing ICHRA movement. Brandy has spent more than 2 decades in employee benefits and healthcare strategy and has built BenefitBay into a national platform serving more than 40,000 employees while achieving exceptional customer sat. What's particularly remarkable is that she's done it from Kansas City, not Silicon Valley, while raising a family of 6 and competing heavily against funded players in the healthcare tech market. In this episode, we'll explore what it takes to build a capital efficient company, the realities of fundraising as a female founder, advantages of building outside traditional tech hubs, and why Brandy believes giving employees more healthcare choice could fundamentally transform the industry. Brandy
Yes,
Thompson,
yes,
here you are, Kansas City in the background.
yes.
I
Uh-huh.
love,
It's a
I
dark,
love.
cloudy day in Kansas City, but yeah, that's the
Okay,
background.
well,
Yeah.
listen, we can pretend it's sunny and nice out there.
Yeah.
Um, Thanks for joining the Liftoff.
Well, thanks for having me, Keith. I'm
You know,
excited.
I just interviewed a CTO and a CEO of a crazy startup, and it's not often I get to talk with people about HR and employee benefits, but I felt like it's the time. It's like let's
Yeah.
continue to expand our conversation and provide insights so founders and startups can really understand what's at play here. Just for you personally, what's going on in the healthcare system? What is the approach that you've identified as the opportunity?
Yeah, the approach that we're really focused on in our mission is around starting to deliver consumer choice or competitive advantage, right? Requiring the payers to actually compete for the individual's benefit dollars. That's where we think we can really make an impact and make a difference. And how we do that is through ICHRA. So the individual coverage health reimbursement arrangement allows employers to decouple that choice. They're not making the choice. The employees can make the choice for themselves and allows them to move to defined contribution. We think it's the first step in making a difference in healthcare and trying to move the needle to the impact where we want to be, which is the individuals get to demand something changes here.
Yeah, and look, when we talked a little bit, I mean, we understand that you're operating in Kansas City, you're
Yeah.
not in Silicon Valley. How do you use that as an advantage?
I think it's a strategic advantage because one, the ability to find a builder in this market, there are fewer startups competing for those builders, right? So
Yep.
in this market in the Midwest, there are a lot of people who are really intelligent and who are ready to make a difference and have an impact. They don't have as many startups to go and work at, right? So the competition for us to find that building talent is less. But I also say that Midwest feel of supporting each other. This community, whether it's been 3 references to another party, whether it is how can we help, how can we make an introduction, this community has absolutely stood behind the startups in the ecosystem. And BenefitBay is one of those that has benefited from that. But we have an entire foundation that's been built to support startups and connecting that coastal capital to the Kansas City companies. So that's been a difference maker. I also think, the cost of building here is less expensive. So for the investor, that's an immediate return that you can build here on less capital invested, and we can
That
build a
is for
little
sure.
leaner. Yeah, yeah.
Yeah. Healthcare is often criticized for lacking transparency and consumer choice. Why do you believe employees should have control over selecting their own healthcare coverage?
Yeah, I think it's twofold. I think the employers, one, have too much transparency about the individual employees' health outcomes and health data. So that's an area that just drives a lot of passion in me that our executives inside a company should not know what's going on in healthcare outcomes for their teammates, right? Or for their direct reports or for their executives. I also think consumers making the decision, the one size that the employer has to find is driving up the cost because they have to
Yeah.
buy a network large enough to cover all of their employees across the nation. And so
Right.
some of those higher cost markets are driving up the cost for the lower cost markets. In addition to what's right for me at 50 is different than what's right for somebody at 26 and then somebody at 32 and somebody that's having children, right? So being able to decide what's right for you in the stage of life you are and purchasing the coverage that you need for the outcome that you're in or for your ability to afford that outcome, right? So
Yeah.
just really delivering the right outcome for the individual at the right time, right plan, right time,
Right.
right choice.
Capital
We
efficiency.
can't do that at the employer side. I mean, I am an employer. Right. It's capital efficiency because we're buying up, we're inflating healthcare on purpose
Yeah.
in our current model, right? Because we have to do it this way. And then if you're in a Kaiser area, you can't access Kaiser because your company's now purchased a different product, to cover a different market.
Right. Or you had a company under one coverage, and then they get acquired, and now it's another coverage, and you have the other one, and
Yeah. Or you underwrite a deal
yeah.
and now suddenly you have a poor outcome for your employees because you've purchased these employees into your self-insurance product, right? So there are so many areas that this really moves the needle forward to where we need to go to capital efficiency, but also just to drive change from
Right.
all sides of healthcare, right?
Brandy, you talk to a lot of founders, right? Startups, early stage companies, 10 employees, growing. Maybe they've
Yeah.
got a nice investment. Maybe they're still bootstrapping to a certain degree, I would imagine, or have a
Mhm.
small check, friends and families kind of investment. What do those guys need to know, that early stage company? What are some of the misconceptions or the mistakes that you kind of see them stepping into as they're building their business and don't really apply the right process to figuring this out?
Yeah, I think a lot of startups are pushed into the PEO model, or they think that's the quickest. I'll just get a back end HR and I'll get my benefits and I'll be doing my payroll. It's quickly becomes a really expensive way to operate in the PEO
Like
model.
how?
As in you're also sharing risk with other parties and you're jumping into a shared risk pool, but you are also limited to the products that that PEO has. And so you're going to limit choice for your employees.
Oh,
You're also going to drive up per head count, right? So that balloons on you. It's really cost effective sub 10. Now you're at 50. It's not as cost effective. You have to unwind everything you built for scale. That becomes your HRIS system. That becomes everything that your employees are doing. So now to build those items and to unwind what you did, you now have to build it to bring it internal, right? So sometimes that easy button when you're starting becomes much more difficult to unwind. So I'd say
mm,
that's something to consider. And I really think if you're planning for growth and rapid growth because you are a startup and you believe in your idea and you've gone and raised some capital, you should build for that scale. So you can take the harder route now so that it equals a better outcome later. I also think when it comes to ICRA, they are often just going with the direct to consumer tool that can only fit them in the micro stage that doesn't have compliance later. So then that's something to unwind. They're often putting people on exchange and on exchange policies. So that's inadvertently driving up the cost in some of the markets. So they're making some of those mistakes just out of trying to build fast and doing the quickest tool.
so is this something between trying to use a simple software tool that automates more and does more with AI perhaps versus the human touch kind of higher level of concierge service that we see actually reflected in the healthcare system now into the services side of the business?
Yeah, I think you need both. So BenefitBay really believes, and it's the intersection of the two. You have to have
Mm,
the technology, but you also have to have the humans because there are all different types of people inside our workforce, right?
yeah,
And some are tech efficient, some are not, but also some are more risk bearing and some are lower risk tolerance. So they want to talk to somebody to confirm they understood what they saw and what they selected
right.
to feel comfortable. We want our employees who are our employees of a startup to feel really well stewarded and that they're in the game with us and that they're well taken care of, because back to transparency. But if they've gone through this great technology flow, but they're feeling uncertain, right? Because they're just not sure it's the first time they've gotten to do it. Let's just give them the option to talk to somebody, right? And we're seeing 25% of people want to talk to somebody that first time they get to make decision in healthcare themselves because they're just unsure on co-insurance or a tier of drug or, this is complicated. Health insurance is complicated on purpose, I think. So that mistake that they may make may cost them a lot of money, right?
Yeah.
So that's a financial outcome for their family. So there again, there's a little bit of nervousness about just relying on AI or just relying on the tech. Of course, the technology can steward 75% of the people through the decision. 25% of the people, which is what we're seeing with real cases, are needing to talk to somebody. Then
Well,
when they renew, only 8% of the people need to talk to somebody. And a lot of times those 8% are because their plan pulled maybe a hospital out of network, or their plan changed their tiers on their drugs. And so they're maybe wanting to look at a different carrier, and they're just wanting to confirm they're going to get what they used to have. But it definitely comes down. They become better consumers of healthcare after a year or two.
Brandy, that's really interesting. So, not to go too deep into a rat hole there, but a quick follow-up. So, are you suggesting that you could possibly do both? You could work with
Yeah.
an AI tool, an AI platform that's the coolest software, but they should still have a representative on the services side helping them navigate that stuff for a select amount of their employees that just have special requirements or just, not as comfortable with the automated approach?
Absolutely. It has to be because we also play in the larger space. And a
Really?
lot of these employers are coming off of self-insurance. Some of these
Yeah.
employees may have cancer outcomes,
Yeah.
right? They're in the middle of services. So we can take that human steward for those complex cases, and we can do it in advance of the program going live technology, right? It just
Yep.
meet employees where they're at, help them feel supported. That
Yeah.
you absolutely have to do that. So yes, we have to be able to afford to run a business. So it can't be all people. It has to be tech, right? But there has to be an intersection of those two. And that's
Yeah.
why we've been really conscious about how we've built once we saw that need. 21 to 23, we thought it could be true SaaS and true tech, and everybody could do this themselves. We quickly found there was a gap in the humans that can't do this themselves. And so we stood up the services based arm. So the combination at that vertical is really what's helped us move the needle to the larger enterprise groups.
Hmm.
Tech companies are going to be more tech savvy, right? You've got a startup, everyone's able to code. So obviously they're able to research and even maybe run a prompt to decide which plan is best for them with their specific questions they care about. But as you
Yeah.
move that needle and you've got a population that has 500 corporate and 3,600 non-corporate, then you're navigating all different socioeconomic statuses, education levels, tech
Yeah.
stability. Some people don't have a computer, they're doing this on their phone. You're selecting and comparing plans on a phone, right?
They're
So,
like my dad. They still don't have a mobile phone.
I mean, there's a Medicare eligible population that are sitting inside these employer groups, right? And they need to
Yeah.
be stewarded
They're
through
still
those,
trying to adjust the ears on their television to get the signal.
right? We have, I believe, 10 million boomers still working in the workforce that
Yep.
are at the Medicare eligible age, but are on our group insurance policies. When we
Mm.
give them choice, they've been getting told they have this one plan, and that's the only
Yeah.
choice, or they have this one carrier, which is the same network, but you have three options, three
Right.
flavors of the same ice cream. So this is a big change, right? It's change
Right. It
management.
is. Hey, speaking of big change, Brandy, you are, I think I'm getting this correct, the CEO.
Yes.
You're also in Kansas City,
Yes.
and you're a mother of not three, not four, not five,
Six.
six kids.
Yeah.
Six?
Six. Yes.
Okay, that's the basketball team plus one ready to come in and sub, which I
Yeah.
like. I mean, you
Yes.
always need that sub ready to come in. But how's that been different for you than, say, the traditional journey of somebody? You're a CEO. I mean, you're running a big company there.
Yeah. I mean, I think one, the journey has been different for me, as in the pedigree of the resume has been
Hmm.
different. And so when you have six kids, my six kids span 19 years. So I was in that having a baby, raising toddlers stage a lot of times in my career.
Yeah,
So I may
yeah.
have chosen the lesser travel role. I may have chosen the role that wasn't with the, Fortune 500 publicly traded company. And
Hmm.
so that's a different route, right? In a lot of those scenarios, I was working for lifestyle companies or companies that were doing M&A to be able to exit eventually, right? And so learning multiple skills because I was in smaller companies that allowed you to stretch and be curious and jump in and dive in. I think that prepared me. I think being a mom of six and having to juggle at all stages of my career made
Yeah.
me a massive, I'm an organizational genius of getting my work done, but also running and showing up for my family or prioritizing the integration of life and work. And that allowed me to prepare to be a CEO. But I also think raising six different children with six different personalities, they're all girls, but they are all different,
Of
taught me a lot of
course.
EQ for
Yeah.
really leading team that comes from all different personality types or shows up to work differently. And I think the different industries prepared me for Benefit Bay. I've been in construction, I've been in specialty insurance, I've been in pork manufacturing, right?
Mm.
Being able to see where these employers are really playing, how their structures are, knowing how their employees are going to show up to an enrollment experience or not, right?
Yeah.
That's helped us plan here. Yeah.
Brandy, that's been super comprehensive. This has been a really great conversation. Share with me and my audience here some that leadership lesson or two that you've learned that you can pass along that will really help this next generation of founders.
I think the number one is you can lead without a title or influence. So
I
the
like
position
that.
that I think really prepared me for this job
Mm.
was my job right prior to this. It was Limelight Health. I was taking a step back in my career to a senior HRPP title to be remote. I was being a business partner for the entire org to help them get the right outcomes, but I did not have any direct reports and I had a title that was very ambiguous that no one really respected. Prior to that, I'd always been a VP of finance or CFO. You have immediate respect because of the title, because you control some purse strings, because you have an immediate seat to the CEO. That senior HRBP, I had to navigate building influence and cultural impact, but also business outcome without any direct authority. If you can master that skill, you can really master any conversation because you're trying to build that trust and influence with the value that you add at the table. And you quickly are invited to more tables, right? And I think that was the most impactful experience in my career. I think early in our career, we're thinking about, for me, I was an accountant. I'm going to be a staff accountant, senior staff accountant. I'm going to be a controller. Then I'm going to be a VP of finance. Then I'm going to be a CFO. That keeping that really narrow mentality keeps you away from other opportunities, right? And just staying focused in the finance lane is not going to teach you how to run
Yeah.
a business, right? You need those operational skill sets, you need the HR skill sets, you need to be able to lead team, and all of those things have to come together. So that's my number one. My number two, and we have an intern class, and I was just sharing this yesterday. You never know when you're going to have to pull in a favor to survive in business, especially if you're trying to run your own business. So being able to show up for others when there's nothing in return early in your career is really important. Never burning a bridge is really important. Keeping those relationships and feeding them and fueling them is really important, right? Somebody asks you to show up for their fundraiser and they've never asked you for anything, show up for the fundraiser, right? Then when you're in a different situation and you need to make that call, you're not just calling somebody for something. You've been delivering value before you need to make that call, and people will pick up the phone, right? And I think that that's lost on the younger generation right now.
Yeah.
You have to be a little more selfless to be able
Yeah.
to continue to evolve. And, technology is not going to get us everywhere. Relationships are really how business is built, and being able to master those relationships and actually deliver value is how you continue to move the needle, especially in a startup. You're gonna
Yeah.
you're gonna need to call in.
Oh
We've
man,
raised a
yeah.
lot of the friends and family money, Keith, and so
I do a lot of that advisory work too, and that's one I don't have in my playbook, but I'm stealing it. I'm at
okay. All right.
No, it's great counsel, great counsel. Thanks so much for sharing all of this great insight for me.
Yeah.
If our listeners want to learn more about Benefit Bay and possibly connect with you and your work, where can we find you?
Yeah, I mean, I'm on LinkedIn, Brandy Thompson, or Benefit Bay, it's sales at benefitbay.com. You can get to me at brandy.thompson at benefitbay.com and really learn more about us at our website, just
Yeah.
at benefitbay.com, a little bit more
And do
about
you do
my work.
something for initial consultation? Do you have some kind of walkthrough or do you do something like that?
Yeah, absolutely. So
Yeah.
we can do a demo, we can do an initial quote. All of that is free.
Yeah.
There's no cost to look at your employer benefits program, see if choice would really move the needle from a cost perspective and give
I
better
love it.
outcomes to your
Uh,
team. Absolutely. Yeah.
Randy, really, thanks so much for your time. I feel guilty taking the time of a mother of six and a
Oh
full-time
no.
CEO job with the number of employees and everything. Have a great day. Thanks for
Yep.
sharing with us.
Thank you,
Give my
Keith.
best to Kansas City, and we'll
Absolutely.
we'll see you on the road.
Okay.